Okay, good morning. Welcome to another episode of ComplyPlus Presents. I'm here again with Dr. Richard Dune for another edition in 2025. How's your week been?
Busy. So
as always.
Yeah, we've just finished one of our modules at UCL. So it was the final day, so hectic. But anyway, let's get into our podcast.
Excellent. So yeah, today, lots of different things obviously coming out, particularly in the last sort of fortnight in the world of health and social care. But today we wanted to look at the evolution of e-learning in the health and social care industry. And with a lot of talk at the moment on AI, the scrapping of NHS England, and almost a rethink on how some of these things are done in the sector, and obviously that will affect the professionals in it. It feels like a good time to maybe discuss this and look at a bit of a timeline really on where the UK has come from, particularly since the early 2000s. So, like I say, maybe the best place to start is the early days from when we actually come into the sector, just under, probably around 15, 16 years ago.
I can go back even further.
Yeah.
To say the introduction of e-learning in the NHS, that was probably around the early 2000s when we started seeing e-learning. And I joined the NHS. My first job in the NHS was in 2004 after I had qualified, but I'd spent a few years obviously working in different NHS trusts. And it wasn't really accepted as a meaningful training format. People just used to just dump stuff there. Then you go and read it.
And, it's like comprehension in a way.
Yeah, there's technical issues. Even UI, UX, there's no thought to it as well.
No.
So these are the very basic module systems where you just click next and you wait for a few minutes for it to go next. Then it crashes. And I don't think organizations took the platform seriously.
No, resistance in a way.
Yes, it's second-rate solution where people used to just dump stuff.
Yeah,
and now you talk about NHS England. They were now controlling e-learning for healthcare, health education England, and all that. So it went from one end where it's not accepted at all to another end where now all the training is now being put on this platform. And you have dealt with NHS England. No disrespect to them, but there's a reason why in the end the organisation just failed to deliver in most of the things that were expected of them. Because our experience became, you have to work with them, because if you're working with NHS trusts, or if, for example, you're talking about that Oliver McGowan mandatory training, in the end we gave up, actually.
Yeah, it was a very tiring process.
It was a very tiring process as a private company to be wasting so much of your resources to a completely dysfunctional system where it's nameless, it's faceless, and so we went from one extreme where it's barely used at all to the other extreme within 25 years where everything is not being dumped online, and it's almost like, well, that's how things are going to be done. Yeah. So it's been quite an interesting journey for me on a personal basis. I don't know, from you, obviously you joined us much later, in this business. What are your thoughts and experiences, your early thoughts and experiences?
Yeah, I mean, the way I look at it is the key players of e-learning when I first joined this business and we were moving into the sort of e-learning world, they're all gone now.
Yeah.
Most of them are gone.
Yeah.
Or if they're not gone, they are not on the perch that they were on when I joined. So it shows that evolution with the new tech advancements. It shows you who the innovative companies were, and you're seeing a lot of fast-growing companies now that are coming into this space and really taking it by storm. But yeah, I think I completely agree. There was definitely a struggle for acceptance. There was and there still is amongst, I think, purists, the idea that e-learning isn't training. Anyone can go and do this, anyone can go and do that. These people are probably not aware of the advancements in e-learning now, but particularly when you first come in, it was more like a comprehension.
Yeah.
It was almost like flicking through a PowerPoint. There's some questions. If you go back to the presentation, you're going to find the answers. Are you really being trained? Are you really competent?
It's focusing on completion.
Yeah. How do I
People
pass?
People are getting a certificate of completion, because it was funny really where some of the most common Google searches were answers for this company's training.
Yeah, question 2 on this. So it's almost like the driving test in a way. The way you'd revise for a driving test is you'd keep doing it, so you memorize the questions basically. And I think back then, like I say, in the early stages, I'm talking sort of 2014, 2015 period here. That was what it was like. Like you say, poor user experience. You could only use it on maybe a laptop. You couldn't use it on a phone or a tablet. It was clunky. The colour schemes, the navigation was poor. But it was sort of new. And at the time, I suppose it felt like this is the new way. Obviously, where we've gone in those last 10, 15 years has been quite remarkable. And, if there's the same rate of progression for the next 10, 15 years, it'll be a really interesting area. But yeah, they were my experiences. It was difficult to speak to clients about e-learning. They were still very focused on face-to-face.
Yeah.
But we know with things like budget constraints and the costs, obviously, for even private providers like us delivering that sort of service, they just weren't matching up. Costs were increasing. What people were willing to pay was decreasing. There needed to be a medium in a way. There had to be another way of doing things. It's even like what we're seeing now with CQC, trying to digitise, create a platform. A report come out earlier this week, I think, about how much that's cost.
I saw that.
So everyone is going
still not
digital.
Quite working.
Oh no, it isn't working. No, I think 30% of it is working in terms of functionality.
Yeah.
The other 70% that was promised isn't actually there. So it sort of shows you that with this digital stuff, as good as it is, there's still a lot of challenges. But yeah, particularly with e-learning, they were the main struggles. I think a struggle for acceptance, the change management side of it. Like I say, most people were doing things in person, face-to-face, blocking time out of busy days. The idea of doing that now with how overwhelmed some of these services are, particularly public services like GPs, hospitals and so on, there's no way you could fit in everything that you're asking them to do online and then convert it to a face-to-face training session. It just wouldn't be feasible. But I think also the delivery of the e-learning has changed a lot from the initial systems that I was introduced to and I was researching. Like I say, a lot of it was almost like a PowerPoint that's been put into some sort of application on a website. Now you've got such big advancements in the interactions, even the way you assess people, different types of media. You've got videos, you've got infographics, you've got heat maps, you've got all these different things. So yeah, for me, it's a different world from where it come from. And like I say, even when you look at the big players back then and the big players now, it shows you the shift and it shows you the theory of sort of business innovation, that if you don't keep improving, you die. And I think that's quite an interesting sort of thing to think about with e-learning. And I'm sure there's going to be current players now that will fall behind. There'll also be emerging players coming through that will take the market by storm. And even for us, we're always looking to try and improve the product. Yes, we want to do what we're doing with marketing. We want to try and sell and this, that and the other. But if you don't keep the product up to standard and keep improving it, keep finding ways to improve the experience, mainly for the end users, then you've got nothing really,
Yeah, I do agree. And, it's funny, isn't it, that to say the biggest provider now becomes NHS England. And yet actually sometimes even Skills for Health and all these organizations are coming to us for content. NHS trusts are coming to us for content, but they get the budget. But then still ineffective.
Fail to meet demand, really.
Fail to meet demand. So my experience, obviously, we started with, when I go back to the NHS, we used to do face-to-face for everything. So you'd go to, to the lecture hall and there's about 100 or 150 of you. Then somebody standing in at the front and going through slides for health and safety. They do one for fire safety. Somebody comes in and talks about infection. Safeguarding started being introduced around the mid-2000s. Same slides every year, same jokes every year, the same. And then lunchtime, you break into groups now to go and do your moving and handling and resuscitation. But for some of us who are having to do advanced life support, then you go and do it separately, face-to-face. And what they were doing in those presentations for health and safety, fire safety, those were the first ones to go online because a lot of them were just basic awareness.
Yeah.
So from an instructional design perspective, it made sense. But the content was inflexible. The systems were clunky, slow, very poor user experience. They have improved. Even the NHS systems have improved now. Some even local authorities, some of them were using outdated Moodle systems up to just a few years ago. Right, so it's good that things are advancing. But now, even for us, by 2016, we're already doing blended learning.
Yes.
Because you sort of think, okay, what can we put online? Because at least we were using Tin Can and SCORM.
Which were the modern
which
ways
were
of doing
modern at
things
the
then,
time and quite responsive. People could do their training online on the phone, on the mobile phone, and you could put videos and it doesn't crash the system. So blended learning for us was a very early innovation where you cover the theory online. Even where we were going to train people face to face, you could reduce cost by actually covering so many things online. Then you just go for a very high impact practical in-person course.
Yeah.
Then you are, rather than just giving them a certificate of completion, you are actually assessing competencies. And you can then, organizations can then sign people off. But most importantly, for me, the barriers were obviously the systems were not usable. There was inertia as well. People didn't think that e-learning was worthwhile.
Yeah.
It's not really a form of training. So there was resistance, and there was lack of organizational buy-in as well, leadership buy-in, and staff just hated it in most cases as well. So a lot of these innovations failed because they were designed for IT departments. Even when I worked in the NHS, this sort of thing, e-learning, it was mostly to do with the IT departments. At the time, I didn't know anyone in clinical practice who was involved. It was mostly an IT thing to do e-learning.
Yeah.
So they're not designed with the user in mind.
Yeah.
Right. So to look, how does the user engage with this content? So things have changed in that sense. Then for us as a business, very early on, blended learning was a compromise that many leaders, managers and leaders were happy to live with. So, okay, I get it now. We cover the theory, then we cover online. But we then went further to sort of say, look, you do, because a lot of the work, whether you're a doctor, you're a nurse, you're a care worker, healthcare has always been about apprenticeship. You go and do the theory, or even if you go and do your degree in nursing, then you come to practice, or you do your degree in medicine, you come to practice, and you work under supervision with someone, then you're signed off for your competences. So e-learning is perfect, actually, for health and social care.
Yeah.
Considering the nature of the industry where there's a lot of on-the-job training, work-based assessments, but it has to be adopted correctly. And the design is crucial as well, the instructional design, because how you teach people face-to-face and then how you deliver the same content online is quite different. And many organizations, including even e-learning providers, some of our competitors, are failing to get that. One of the most crucial parts is instructional design so that people don't get bored.
Yeah.
Just clicking next,
clicking the same button
and then they get a certificate at the end. Because some of these courses actually, they send you straight to the assessment. Because organizations sometimes are requesting that. Even we have had people saying, can we just go straight to the assessments? And they think, well, if you're going to be holding our certificate with our logo, our accreditation, you've got to go through the course. You've got to do in-course assessments. And then you get to the end of course assessment, because what's the point of just going straight to the assessment? Tick box.
Yeah.
So that we comply.
Yeah.
Yeah.
100%. And we know that those sort of systems still exist, unfortunately. But so I suppose obviously COVID-19, you can't talk about the evolution of e-learning without discussing the pandemic. And COVID-19 really was quite a tipping point. Almost like was a catalyst for this transformation and forced the non-believers, let's say, or the people who had that resistance to just accept it and get on with it, because compliance didn't stop during COVID. There was obviously some reliefs. There was some workarounds in terms of, people's training expiring and so on. I think there was a bit of relief given there by the government and governing bodies, but it still had to go on, and we didn't know when the pandemic was gonna finish. But also, training was more important because rules were changing as the pandemic was as it was going on and as it was evolving, the different news coming out, the research about the virus and so on.
Updates even as well.
Yeah, so even people had to be trained on coronavirus, what actually, what is it? What are the dangers? How do we deal with this? There was changes in infection control protocols, health and safety, even the life support changed, I think, for a period of time, didn't it? So, it shut down the in-person training overnight.
Yeah.
E-learning became essential, wasn't optional. So how did you find that sort of period? Whether you were engaging with other professionals in your network or other stakeholders or even other businesses that we were working with?
I think it's interesting because what just a few months before was a second-rate alternative suddenly became the backbone for compliance, workforce development, and ensuring that people are safe at work. Because we had to write a coronavirus course, what is COVID-19? And then we're updating it every week.
Yeah.
And it was not, I think that course, because we gave it for free, more than 100,000 people signed onto that course. Even people that were working in the NHS, because there was a bit of a delay. We worked very quickly to do that. But for me, sometimes actually you need those pivotal moments for the balance to tip. If you look at, like my area is diffusion of innovations in healthcare, there were some people that we worked with that just got it straight away, right? So that 2.5% just got it straight away very early on, around 2014, 15, when we built our first platform. Then we got another 10%, maybe up to 2016. We had to price a lot of people out, especially the adult social care. We struggled really for them to accept e-learning. And what we wanted to charge for the face-to-face, they were not willing to pay. So we ended up looking at specialist providers. Right, so the COVID forced everyone to go to e-learning because there's no alternative. Even some of those companies, the care companies, care home group, domiciliary care companies that didn't consider e-learning as worthwhile at all of a sudden we had to work with them. All of a sudden we had to work with local authorities. I remember two courses in particular actually. One was verification of death, which were done for hospices. And the other one was clinical observations, which were done for small agencies that were sending people to the NHS. Those became the crucial courses because so many people were unwell now in care homes, in their homes, and care workers needed to check observations, and care workers were now verifying deaths. And I remember the first meeting we had with a few of the local authorities saying, but we wrote this course for nurses. It's a clinical course. So, we haven't got a choice because district nurses are not coming out, GPs are not coming out. So we had to change that course a little bit so that care workers, you look at the language and all that. So why I'm saying that? Because previously to deal with local authorities was very cumbersome. To deal with the NHS was almost impossible. But then all of a sudden, they were looking for solutions wherever they could find them. And we were well positioned to provide those solutions with a very interactive e-learning platform with huge amounts of content and with a huge turnaround time. If they wanted new content done quickly, we could build it very quickly and adapt it very quickly. We were running webinars because we were using Zoom way before COVID. We were using a lot of these AI tools way before COVID. So we were well positioned. And I think when I look back, actually, I don't remember, I know the pressure during that time that we were working with, but it was from a work perspective, how satisfying it was to work like that, to be able to come up with solutions. There were people buying our courses or taking our free content in Pakistan, in the Philippines.
It was worldwide.
In Kenya, in Jamaica. Worldwide, people were looking for solutions. And from a business perspective, we got a lot of business, right? But what for me was satisfying was providing solutions to real world problems. I felt that at that time we became a truly global company without even seeking that sort of position. But also, all of a sudden, some of the solutions that were very expensive before COVID became readily available. There were a lot of developers now who are not going to work or they're working from home, and now they are cracking and coming up with solutions. It changed e-learning forever. Right? In the UK, it was a very small market compared, say, with America. But actually, COVID changed everything. Systems got better, and because it's essential now, it's not an optional anymore. And even for us as a business, some of our systems that we built before COVID we're now being overtaken by newer ways of doing things.
Because it advanced so fast.
Yes, and even some of our customers, because people were trying different things, then they'll come back to you and say, well, this company is doing this. Can you get that? Then you sort of think, oh, okay, how long is it going to take us to develop that bit? Can we find it in open source? Or can we go and talk to whoever has got it already so that we license it so that we can just piggyback it as a solution, as an extra module? So it was an exciting time to be delivering solutions despite the challenges that were there, right? And it changed everything.
Yeah. No, it makes sense.
Yeah.
I remember the time. Yeah, like you say, it was very full on. But like you say, that period of time has definitely changed the landscape now.
Yeah.
And like you say, I think for the better, because the quality that's come out of it now, like you say, it's really groundbreaking.
From your side, though, because obviously post-COVID, things changed a lot for us as a business.
Yeah.
Quite a lot of the business that we got during COVID, people wanted to solve problems. Even the NHS and local authorities, the moment we got out of the COVID restrictions,
yes,
they just went back to what they were doing before COVID.
Yeah, so some went back, some rebounded quickly, some stayed for a while and then thought, well, life's normal again now, let's say. That was obviously challenging. A lot of businesses experienced the COVID bounce, didn't they? That there's lots of different companies that during COVID there was a lot going on, whether that's sales activity, whether that's just general interest, and then there's a bounce. But I think, like you say, it did raise the bar. And I think the point you made about what the customer expects now is a lot higher.
Yeah.
And for any business, for a customer to be, let's say, at a certain level, and then in a short space of time, their expectations are up here. They don't necessarily want to pay any more for it, but they're expecting it. They expect it to be there. Like you say, there were some difficult discussions with some clients and even individual users, and we had to justify, where we are and how we can help them, and also make promises to customers really to say, look, we can get this by such and such a time. And I feel we've, like you say, when customers have a problem, we listen. We don't necessarily drop everything, but we talk about it very quickly, and we look at viable solutions.
So that feedback loop continues.
Customer-centric feedback is important. We're always trying to look at ways, whether it's how we collect reviews, whether it's the check-ins our account managements do. Like I say, whether it's reviews left on public platforms, whether it's on our website. We're trying to improve the idea of case studies and surveys as well. Because from all this, all the data you get back from those, although they can take a while to set up, it can really help shape where you want to go with the system. Because if, like we said in the opening segment, if it's not with the customer in mind, you can have all these great ideas and pat you on the back, but actually, is that going to work for customers? Is that actually going to build a sustainable product? Like I say, I remember the times of COVID. It was very full on, very intense. Like you say, we were getting lots of different requests from pretty big organisations. And I felt we delivered on a lot of those. But like you also said, a lot of them did go crawling back to previous ways, or maybe they stuck around for a while. But then, like I say, in the end, people have gone back to some of the default systems that they were using. So, I suppose that's the nature of the time, and who knows what's going to happen in the future.
So it's quite exciting, because even when everyone is talking about AI now, we've been using it for a while, and most people have been using it for a while without calling it AI. Like, how long have we had prompts and reminders in the system, even drip-fed content and things like that? But now, actually, there's an expectation for more tailoring to specific roles.
I think so, yes.
The existing knowledge of the person, and if they are more knowledgeable, then they can move to the more challenging learning content, some of the more challenging content, but also performance as well. So we've we've been working with the General Dental Council. We've done some content for the NMC registered nurses, even doctors as well, so that our certification process meets the requirements of the professional bodies. So customization actually is even more required now. So personalized pathways, real-time tracking, and then people collecting their CPD points and ensuring that they are complying with their professional requirements, but also from a continuing professional development, because I know that a lot of our content originally was statutory and mandatory training, and it's still quite a challenge to convince people that they need to look beyond statutory and mandatory training, because it's a tick box mentality. We need to move beyond that to actually say, look, you can plan your learning for your own personal development, professional development. So that's one of the challenges that I've seen myself in practice. But also when you look at the lessons as well, from my own practice as a practitioner and then a researcher, and then now actually in this sort of area that we're in, you have to serve the people. E-learning has to be user-centric. So from the instructional design, from the learning outcomes and all that, that's crucial. Then culture change, we don't have to wait for something like COVID to shift cultures. We don't have to wait for disasters to do that.
No.
But when disasters do come like that, let's take advantage of that to really change our thinking. It's a shame that quite a lot of the bigger organizations went back to what they were doing pre-COVID. That's going backwards. But actually, when I see some of the clients that stayed with us post-COVID, some of them that I never imagined would accept e-learning as a solution, and they're now even coming up with solutions even for blended learning, that's really crucial. But also, I accept that not all learning should be digital.
No.
We still have to do practical, but every subject, for example, even resuscitation at any level, whether you're doing basic life support, level 2 or immediate life support or advanced life support, there's an element of theory. E-learning is actually very good for that theory, much better than what we were doing before.
Yeah.
Right? It's better online.
Just boring.
Then they come in for the practical assessments, competency assessments, where they're going to different workstations. So moving and handling, resuscitation, conflict resolution, and breakaway techniques. The theory element, e-learning is a brilliant platform for that. Then people come in then for the practical, for the application. Then compliance should be a starting point. Rather than just using e-learning to tick compliance boxes, I say compliance is a starting point. What do we need to do as an organization? What are the organizational needs? What are the needs of the regulatory bodies? As an organization, what are we supposed to be doing? That's a starting point. But you then have to look at what other things can we do. E-learning can drive patient safety. E-learning can drive some of the clinical awareness of clinical issues. For example, when we work with health, mental health organizations, people that are delivering psychiatry services, there's a lot of evidence that they are lacking skills in physical health, managing diabetes, cardiovascular disease, all these long-term conditions, but also managing a deteriorating patient who's deteriorating clinically, right? But also general nurses as well, people that are working in general hospitals. There are also evidence that they are lacking skills in mental health awareness. So just beyond basic awareness, how would you manage somebody who has clinical depression, but they also have a heart condition?
Yeah,
they are very good at managing the heart condition.
It's a very real situation, isn't it? Yeah.
For me, e-learning is a really crucial element, and those are some of the things that we are doing as a business to bridge these gaps by building content that is tailored to groups of particular healthcare professionals or adult social care workers, so that they gain the additional skills that are not part of the statutory and mandatory training. And I feel kind of silly saying that, because it should be mandatory for general nurses, for example, to learn about mental health. It should also be mandatory for psychiatry nurses to learn about physical health beyond what they learned at university 15, 20 years ago. Right? So I think there's a lot of work to be done. And obviously, I know NHS England had these huge programs that they were developing for the different clusters and subsectors. But obviously, now that everything is moving back to the Department of Health and Social Care, it'll be interesting to see what the department has in mind. But what I know for a fact over many years is that even the organizations we deal with, training and workforce development comes last. People are looking at the big things, in the budget, say, where is this money going to go? Training and compliance and workforce development is always at the bottom. Whenever we get any sort of reorganization, and I experienced it when I worked in the NHS, staff are last. How staff are going to engage with these changes, how staff are going to be affected.
It's the afterthought.
It's the afterthought. And then, many people that I talk to privately, they're worried. So look, how are things going to work? And even the budgets also for organizations for workforce development, people don't know what's going to happen. It's very unclear right now. We have a timeline of 2 years to bundle NHS England into Department of Health and Social Care. But what's going to happen to all these things that were gobbled up by NHS England over the years, including workforce development? It was a challenge, but there was something in place. Is that going to be left to carry on? We deal with NHS Trust. We provide them a lot of solutions. What's going to happen as well? So many organizations that are in the tech sector, workforce development, supportive organizations that were supporting the day-to-day running of an organization like NHS England, we're left in limbo, wondering what should be done. But we can't stop until the government figures out or tells us what they're doing. We still have to carry on and try to anticipate how to deal with any backlash on the back of this. Yeah. But anyway, look, from your side, when you look at the future, because I know you're the one that deals with our developers, what's the future of e-learning? What's going to be next? And it's already a digital wave. How is it going to pan out, and what should people expect?
I think there's a couple of ways to look at it. I think like we're trying to say, e-learning isn't just about training and saying that someone's done this course or done this program. I think the modern day e-learning as a platform can do so much more. It can, like you say, from the learning experience is going to only get better from what I'm seeing. Obviously, it will have its ceiling because even here in the UK, there's a limit to how much either businesses or individuals want to spend on this sort of thing. So, I've seen things where there's like these VR type learning experiences and so on. Obviously, if you want those, I know they're available already and they'll keep innovating and getting better. But from an e-learning perspective itself, look, the platforms are going to get nicer. The intuitiveness of them, they're going to be easier to use so that no one, regardless of their computer ability, will be able to use them. The different types of media outputs, interactiveness, it's all going to improve. Even the way you assess people, it's going to continue to improve, particularly for the organisations looking at the new technology out there. And every month, our product development team are getting emails from different designers and authors who are creating these softwares and systems and applications about this. Our thing can do this now. It can do this, and we're sort of thinking, how quickly could we get that on the system? What does the cost look like, and so on. So what I will say is it will keep changing and for the better. But the actual platform itself, what we're trying to do on the product development side is give people more value, give people more useful things that they might need. So that the e-learning experience isn't just about, yes, I've got these 10 training courses to do. What other things is going to be useful to me as a professional or as someone in a business that is managing compliance? What tools, what things am I going to need to prove that we're compliant with people like CQC, local authorities, and any other auditor that may be coming into the business, but actually to help you from a sort of organisational perspective. You've used words like that, like workforce development. You've used words like efficiencies. E-learning platforms now, that's the direction they're going in. That's the direction they're going in. The e-learning itself, as I've said, will continue to improve. The way you assess people improve, hopefully the quality then that people will get from the training. So when people do their training effectiveness analysis, hopefully those sort of numbers will start going into the green and improving. But I think for me, one of the interesting points is the way the platforms are developing, the different things you can do on the platform, the different ways they can help either the end user or the organisations themselves. And we've put a lot of effort, particularly in the last 18 to 24 months in that area. And we've actually got an exciting module coming out for end users, hopefully by the end of April, if not early May, it will be launched, where people can actually track all their CPD, whether it's from our e-learning platform, whether it's from external platforms.
They can upload their certificates and manage that.
Face-to-face. And like you say, that's then going to map with the new professional body certificate template, because that's another key feature that we're adding on.
Because you have to ask them, like in this case, GDC, NMC, GMC, where to actually talk to them. So how do you want this presented, because we are providing CPD training for your staff. This is what the accrediting body is saying we should do.
Exactly.
How do you want the data to be presented? So we have to redesign our certificates as well and the information that accompanies it.
Yeah.
But one crucial element is the training management system as well.
Yes.
With ComplyPlus training management system. Because I know NHS England had done quite a lot of work here with the electronic staff records to link, and we had to link into that system as well.
Yes.
To make sure that our certificates are accepted in the NHS. But electronic staff records is crucial because that's the HR side of things, isn't it? Then there's the e-rostering now, because when I worked in the NHS, we used to have this rota on a spreadsheet. Then they print something out, they put it in a folder. So you go and check your rota and you write everything down. But now that you can have that on your phone, when you're booking training, for example, your training management system, it can then show you where the gaps are with your e-rostering so that you can book people. It doesn't clash with the shifts that they are doing if they needed to do face-to-face or some sort of blended learning where they need to be there. But for me as well, data quality improvement is always crucial. Even yesterday, I was at UCL yesterday and we're talking about innovations just wrapping up on the module. And, one of the GPs, Dr. Chireka, actually, Brighton Chireka was there, and was talking about interoperability. So he said, look, because he's coming from a GP practice and the systems are not talking to each other. But now GP practices, we need to look at what is best practice actually. Why are they having 5-6 systems that can be done by one system? Or maybe you build a dashboard that connects all the systems and then you have one login and the data is pushed to one place. So for me, those are some of the exciting things that we can do. I've come a long way. I've spent 25 years in this sector and I've seen it from e-learning is barely anything to talk about to now everything, even the Prime Minister saying, well, AI, all the healthcare problems, we should use AI, and sort of think, what infrastructure do you need to build AI? What are the things that AI will be good for?
You can't rely on it.
It's not a panacea. It's not going to solve all your problems, right? Yeah. But it's going to be useful in certain areas. So from those clunky systems to compliance engines now, not just ticking boxes, but actually linking with the staff development as well. We've shifted from resistance. Now there's a lot of resilience in the sector post-COVID, and people are more willing to accept different solutions. So I'm very happy with that. And when we look at even what we've done with ComplyPlus, it's been born out of an evolution of the sector.
Definitely,
over the past 20 years. Everything we've learned over the past 20 years is now gone into this system that is an integrated regulatory compliance management system, but also covers the workforce development areas. We're building the clinical governance modules, the patient safety. All these things really matter. And also what we've done as well, even on LinkedIn, I know you write your blogs on LinkedIn for ComplyPlus, and I'm writing my blogs on LinkedIn on the Innovation Observatory, getting people really to think broadly. It doesn't matter what's happening with NHS England. The government decided to do that, but what are we going to do? We still need to develop our staff. We still need to train them so that they're safe and compliant. We still need to look at patient safety. We still need to look at all the governance. So for me, I think the future is bright, and even the competition as well, the fact that we have more competition, I think it's okay. Competition is healthy.
It's healthy,
It keeps us on our toes. But we know that some of the competitors, the first 5 to 10 companies, very few of them are still around.
Yeah.
We are one of the very few that have survived the turbulence on the market. And that resilience as well has really helped to shape the way we think as a business and what we are going to be doing as a business. So for me, coming from a practitioner, then doing research in technology and then running a business in this area, I'm very happy with the way things have gone, despite the challenges. Because sometimes business is not going as well as you want, or you are missing out on some of the contracts because of the way the bidding process is just excludes smaller companies, small to medium sized companies. But actually, the resilience that we've built over the years, we don't bother even worrying about the competition. But it's important that there's competition because you learn from each other. If other people bring in new technologies, it's good to learn from them. What's there on open source. Even our developers as well keep developing and building that team. It keeps us on our toes. So it's a healthy environment in that sense.
Yeah. No, I completely agree. So any other final thoughts before we close? I think we've sort of summarised where the journey and that timeline, and also I think futuristically where we see things going. But any final thoughts for the listeners?
It's quite easy to be downbeat. The world where we are right now is it's worrying. Every day there's something about geopolitics. Sadly, you and I can't ignore the news, because I know some friends who don't listen to Radio 4 anymore. They listen to Radio 3, just listen to classical music when you're driving to work. I have to listen to the Today program and hear what's going on now, the wars that are going on, the geopolitics, what's happening with NHS England, with CQC. It's quite easy to be downbeat because the world is not in a good place right now. But I prefer to be solution-focused.
Yeah, how do we fix this?
How do we fix things? How do we respond? Because we still have to wake up and run businesses. Care companies still need to wake up and look after people. When I go to the hospital, I'm hoping that people are turning up to do their shift and they're prepared to deal with me as a patient. So for us as a business, a lot of the noise that's going on doesn't matter, and I know some of our competitors as well. They feel the same. Every day we're looking at creating opportunities from some of these big issues that are going on, and then come up with solutions to help. Whether it's a local authority we're working with, whether it's a small care company, whether it's a recruitment agency, or whether it's an NHS trust. We get up every day and we do what needs to be done. Yeah. E-learning is here to stay, and it's only going to get better. Gamification, you're looking at tailored solutions, you're looking at AI, getting more AI-powered solutions where people can customize their learning.
Their
own experiences, when they do their reflections to submit for the NMC revalidation or for their interviews, doctors or people that are registered with the Healthcare Professions Council. It doesn't matter. We keep building these solutions and we keep collaborating with more people. Even some of the people that were our competitors, we work with them now. Because actually the cake is so big, there's more than enough for everyone. And actually, you find that sometimes there's no point competing with people. Why don't you sit down and find ways of working together so that you build things quicker and also better quality, and you deliver on time? Yeah.
Excellent. Excellent. Okay. So thank you for everyone for listening. We'll be back in the next couple of weeks with another edition. Not sure what the topic will be yet, but we'll see.
We're talking about mental health, actually.
Mental health. We've got a potential guest speaker lined up for that. Hopefully you enjoyed the last guest speaker, Helen Ivers. And I think the initial feedback was pretty good from what I hear. So, more guest speakers, definitely. That episode should be coming out very soon. So, but otherwise, have a great weekend and we'll see you next time.
Yeah. Thank you. See you next time.